the method I use is called FUE. It's follicular unit extraction. So each hair is removed one by one. So the good thing is you don't get a linear scar across the back of your head. So that's the good
Right,
news.
right.
But there are tiny little scars that form throughout the area where we extract. But the trick is we don't extract from one small area. We kind of,
Right.
expand it out. So it ends up being really not noticeable. But we also don't
I
want
see
to
what you're
go
saying.
above a certain number of hairs, because if I took like 4,000 from the back, that can be, quite noticeable. So it's just about balancing how many hairs we need to create some change that
Right,
you'd be happy with, and also making sure we leave enough hair on the back so that no one could tell that you had, a procedure.
right, right, right.
So
I see what
that's
you're saying.
that's kind of the concept. But as long as you're okay with not a very full look on the beard area and just kind of having some coverage, then I think it's possible to do. Also keep in mind, Anubis, with very curly hair like yours, it's
Hmm.
technically more challenging. So
Okay.
it's just the way it is. It's a little harder to control exactly the angle that the hairs grow out of, since it's like very
Yeah, I see what
curly.
you're saying.
Um, and so that's like, for example, I don't do eyebrow transplants on patients with very curly hair. And
Okay.
that's because it just doesn't, because you take it from the back, and it's just very hard to create a very natural look. The
Mm,
beard is a little bit more doable, but it's just all the important sort of points to think about.